Today, we're diving into a really critical medical topic, upper GI bleeding. This is one of those conditions where your body starts sending out some very clear and honestly pretty alarming signals that something's wrong on the inside. I mean, just think about that for a second. It sounds dramatic, but it's literally what happens with an upper GI bleed. It's not just some random symptom. It's an urgent message from your digestive system, and it's one that demands our full attention. And that's our whole goal here. Getting a handle on these signs is the absolute first step to knowing how to respond. By the end of this, you're going to have a really clear picture of what to look for, what it all means, and how doctors tackle it. Okay, so let's get the basics down first. When we say upper GI tract, what are we actually talking about? Well, it's pretty much everything from your esophagus down to your stomach and into the very first part of your small intestine, called the duodenum. Bleeding anywhere along that pathway is what we're focused on today.
So how does a problem like this actually make itself known? Well, the body has a few very distinct ways of sounding the alarm. Let's get into the strange, sometimes startling signs that you absolutely need to be aware of.
These are pretty much the big four. Some are exactly what you'd expect, right? Like vomiting blood, which has the medical name hematemesis. Others are a bit more subtle, like the slow chronic bleed that leads to anemia, just making you feel exhausted and washed out all the time. But the signs that show up in your stool, well, they're especially telling. And this is where things get super interesting. On one side, you have melena, those tarry black stools. That's a classic sign of an upper GI bleed, because the blood has had time to get digested on its long journey through your system. But here's the twist. Massive, fresh, red bleeding from the rectum can also come from way up top. And you're probably thinking, how is that even possible? Well, it just means the bleeding is so severe and happening so fast that the blood rushes through your entire GI tract too quickly to change color. It's a real medical paradox.
Okay, so we've seen the alarm bells. The signs are clear. But that brings us to the next big question. What's actually causing all this chaos? It's time to play detective and investigate the usual suspects behind the bleeding.
The list of culprits is pretty varied. You've got peptic ulcers, which are often tied to things like NSAID pain relievers or that pesky bacteria, H. pylori. These ulcers can literally eat away at the stomach lining and hit a major artery. Then you have esophageal varices. These are swollen, super fragile veins in the esophagus, often a result of liver cirrhosis. If they rupture, the bleeding can be sudden and profuse. A Mallory-Weiss tear is more of a physical injury, a rip in the lining caused by really intense, forceful vomiting. And sometimes, of course, the cause is more serious, like stomach cancer. And this right here is exactly why having an expert take a look is so critical. During an exam, a doctor might see an ulcer that just doesn't look right. It might have these specific features, like edges that are turned outward and a center that shows dead tissue. Those are huge red flags for potential malignancy, and they demand a very careful investigation. So we know the signs, we know the potential causes, but how do doctors actually connect those dots and pinpoint the exact source of the problem? It's time to get the inside story on diagnosis. You know, when you're trying to solve a mystery happening deep inside the body, there's really only one way to get the true story. You have to get a direct view of the scene. You have to look inside. And this is the tool for the job, the hero of our story, really. It's called an upper GI endoscopy, or UGI for short. It's the gold standard because it's not just a camera for looking around. It's this incredible instrument that lets doctors both find the problem and, a lot of the time, fix it on the spot. So let's break down what this one amazing procedure can accomplish. First, they can see everything in high detail. Second, they can identify the exact spot the bleeding is coming from. Third, they can take tiny tissue samples, biopsies, to check for things like H. pylori or cancer. And finally, the amazing part, they can use tools right through the scope to actually perform therapy and stop the bleeding. It's an all-in-one mission. This quote really drives home just how thorough this process has to be. A cancerous ulcer can sometimes pretend to be a benign one. So if there's even a shadow of a doubt, doctors won't just rely on one negative test. They'll go back in for a second look to be absolutely certain. It's a huge commitment to getting it right. Now, before an endoscopy happens, especially in a true emergency where the patient has severe pain, there's another crucial first step. They'll do a simple X-ray. What they're looking for is a perforation, a hole in the stomach or intestine. The telltale sign? Air where it absolutely shouldn't be, trapped under the diaphragm.
That's a surgical emergency that has to be ruled out right away. Okay, so the source has been found, the diagnosis is in. That brings us to the final critical piece of the puzzle, the plan of attack. Let's look at how medical teams mobilize to stop the bleed and treat what's causing it. The very first move all depends on the patient's condition. If they're unstable, meaning they're in shock, blood pressure is dropping, the number one priority isn't the diagnosis, it's resuscitation. It's about saving their life. That means pumping in IV fluids and securing their airway. Once they're stable, then they can move forward with the endoscopy. And the toolbox doctors have for treatment is just incredible. It's definitely not a one-size-fits-all approach. For those bleeding varices, they can use tiny little rubber bands to tie them off. For ulcers, they can deploy hemostatic clips to literally pinch a vessel shut or inject medication. There are also IV drugs like terlipressin that can lower pressure in those veins to help stop the bleeding. And of course, in that worst-case scenario of a perforation, that's when surgery becomes the ultimate fix. So when you look at the whole picture, from that first alarming sign all the way to the sophisticated therapies that can fix the problem, it all comes back to a powerful reminder. Our bodies are constantly communicating with us. The real question is, are we prepared to listen?